Hi there, everybody out there in webinar TV land. It's so great to have you with us this evening. Our apologies for being just a couple minutes delayed in getting started. Me and my incredible administrative team here at MaxWell Clinic were just getting all of the tech support up and ready to go so that we could maximize our time together this evening because your time is incredibly valuable. So let's dive right in. You are most likely attending this webinar because you feel that you have some memory slips, or maybe you're concerned about Alzheimer's and dementia in your family, or you have that elusive brain fog or fatigue, or the most precious organ that runs your experience of life, your beautiful brain, is in any way not optimized for you. So let's dive right in. My name is Lindsay Jost. I am a nurse practitioner. I have been with the MaxWell Clinic for almost 9 years, I think, which is a beautiful amount of time to really dive into functional medicine and integrative personalized systems medicine, which is kind of our unique spin. I work alongside Dr. David Hazy in our deep dive patient program here at the MaxWell Clinic. However, I also have the pleasure of heading up development of new service lines from a clinical perspective here at our clinic. And one of the most exciting new offerings that we have is our cognitive health assessment that we are now offering publicly starting October 10th. So let's dive right in. Let's see if it's the right fit for you or a loved one and go from there. At the end of this webinar, they'll be open for questions and answers. So be sure to put your questions into the Q&A section, and I'll make sure I address all of those if time allows. So let's begin by understanding your cognitive well-being and why it's important. So cognitive health, brain health is central to everything that we do. Our brain is our business, as a mentor of ours and beloved patient has said. Not only is that true for all the entrepreneurs out there, but that is also true for the mothers. It's true for the fathers. It's true for teachers, business, bankers, and everybody in between, because without your brain, you're not able to participate and engage in this one precious life that we have. So it's interesting. A lot of us, if we are in pain, it's all we can focus on. So if our stomachs are bloated and upset, or if our knee is hurting, or hip is misaligned, or something's not working, that tends to get our attention, but that's getting our salient attention from our brain. Everything that we perceive in life comes from our brain. So reorienting that to being our most precious of organs, I think, is actually a really big personal aha whenever that really landed for me, that this thing in our skulls that we see from, feel from, perceive from, move and breathe, and is signaling a lot of the different things that engage us in life, doesn't always get center stage as I think that it probably deserves. So cognitive health is, one could say, one of the most important aspects of our overall health picture. So the main thing that we're going to talk to you about today is test, don't guess. So cognitive function can be a little vague and elusive. What that means is you might be feeling a little bit of brain fog, a little bit of, I walked into a room and why did I walk into this room? What was that person's name, but I know their face? That math I used to be able to do. And there's a lot of assumptions. Some people go to worst case scenario. Oh, my great grandma had Alzheimer's, so this is it. This is the end. Or that's the other side of the spectrum. That's not really a big deal. I'm just going to push under the rug and move forward. What we're offering now at MaxWell Clinic is an opportunity for you to come in and have an expanded cognitive assessment panel and evaluation, so that we can not be guessing, so that we're not in denial, and we're also not in over assumptions on what could be going on, to help guide you in next steps so that you're taking a proactive approach to your precious brain health. Some of the signs and symptoms of cognitive decline that can go unnoticed. Anytime we say this list, people get a little like, oh no, that's me. It's worth going into because it's not just a part of getting older. So there's this sort of fallacy that, oh, it's just age related. I'm just going to lose my memory function. And that would only be true if 100% of the people that were getting older it was true for. There are people in their 70s, 80s, 90s, and beyond that are incredibly sharp and do not experience memory lapses. It exists, which means that it's not a guaranteed part of aging. So I think it's really important to reframe, not to be fearful, but so that you can take your body communicating with you as an opportunity for proactive assessment. And that's what we're all about. Some of the early signs of dementia or Alzheimer's that may go unnoticed are subtle short-term memory changes, difficulty finding the right words, changes in mood, some apathy, some indifference and not feeling as interested, difficulty completing normal tasks, confusion, challenge following storylines and listening to people, a failing sense of direction if you're getting lost while you're driving, being repetitive and struggling to adapt to change. Now, if any of those things sounded like you, please do not be in fear because while yes, those are early signs of dementia and neurocognitive decline, those are also signs of a lot of other things that could be going on and creating those symptoms, such as stress. High levels of stress can cause some of those symptoms. And sometimes it's hard to suss out, is this a life circumstance that's causing me higher levels of stress, and that's why I'm having these memory challenges, or is this early signs of neurocognitive decline and dementia? And that's what we're here for. We're here to help you get clarity between those two questions. So early detection and intervention is key because there is one slope when it comes to neurocognitive decline that has been proven, which is it declines. However, if you find things early and you can put yourself with the help of a clinician into a bucket of probability, we'll say. So this is most likely a life stress circumstance. This is most likely a genetic risk taking over. This could be early dementia. Then there are actions and things you can do, both lifestyle supplement, treatments, procedures, protocols. There's all kinds of things that can be done to slow down that progression, increase your quality of life, and also give you peace of mind. So that way, at the end of the day, we like to talk about the pillow test. We say that in clinician world of, if I put my head at a pillow at the end of the day, am I going to be worried about my patient, or did I do everything that I could? But it also applies to patients. And have I done everything I feel like I can do to take care of myself? Because you are worth it and of value to be taken care of. The consequences of dementia are vast. Loss of independence, loss of sense of self. And if you don't have a sense of self, then having quality of life and purpose and meaning for why you're here really dissolves and goes into the ethers. Loss of contribution to society. It's so interesting the number of people that we find when we get to deeply know them, that feeling useful and is one of the things that drives them the most. I want to be helpful. In fact, it's really interesting if you start to observe those around you to see their intrinsic motivators, that a lot of times it's because they want to be helpful. Sometimes they don't always know that they're not being helpful, but humans are really driven to be of service, which is a beautiful thing. And you can't do that if you don't have your mind. Financial burden, no matter the path of denial or action. So dementia causes a financial burden, whether you take proactive action towards it, or if you deny it, it's going to happen either way. So being really responsible with your resource utilization proactively is something to always have a conversation about with, in the ecosystem of your financial home. Burden on caregivers is significant. And unfortunately, one of the major consequences of dementia can be death. A third of seniors die of Alzheimer's or another form of dementia, more than breast cancer and prostate cancer combined. I want to say that again, more than breast cancer and prostate cancer combined, two of the most common cancer types. So there's a lot of longevity research that is being driven towards decreasing cancer risk, and that's beautiful. We do a lot of that here as well. It's important to put into the conversation the organ that we don't always pay attention to, our beautiful brain, as being something to focus on as well. Obviously, cardiovascular disease and prevention of that is really important as far as death rates go as well. But Alzheimer's and dementia is creeping up there. And so it's important to have this conversation young, early, and with ease, so it doesn't feel like this crippling weight of fear that's incredibly normal and natural along this path. So we've had a number of individuals and patients with real life examples who've benefited from understanding their cognitive well-being. We had a gentleman who had an actual diagnosis of Alzheimer's from a conventional physician, came to us, mood changes, was really short-tempered, wasn't able to run his company anymore. He came to us, had a full cognitive evaluation, went through plasma exchange. Not only has he had his Alzheimer's diagnosis removed, so he's a superstar story, but he is back to working, back to engaging in his life and business. His memory is better than it ever has been, which is a tremendous story and not the most common of responses. So something that's really important when you talk about neurocognitive decline is that there's really three main goals. One is to stop progression. It's just, if we can just maintain you at a current level, that's a win. And I really want to emphasize that. That is a win. If you ever come for plasma exchange here at our center, you may not feel it, even though the number of toxins in your body have been decreased. However, you won't know, because we don't have a clone of you going through the exact same life at the exact same time. We don't know where you would be if you hadn't had done the procedure. So slowing progression is really, really key. The other, of course, would be reversal. That'd be amazing. And then, of course, symptom improvement as well. So that does happen every once in a while. And the patient I just spoke of, that happened to him and his family, which is amazing. Another patient example who benefited from really diving into his memory was a gentleman who came to us in his early 50s, and his significant other and spouse really encouraged him to come have an evaluation with us because his memory was challenged. Short-term memory, not tracking in conversation, forgetting to buckle their child whenever he was driving, and a couple other challenges that were just odd and out of character. So what's really interesting is we did a full evaluation on this gentleman, and it turns out that a lot of his memory challenges were stress related, that they weren't in fact early Alzheimer's or dementia related. So getting that assessment piece to delineate that was huge. A woman who was going through menopause, turns out a lot of her memory challenges were not actually neurocognitive decline, they were hormones and menopausal changes, because menopause can definitely affect your memory. Young girl in her 30s who has had a lot of childhood trauma. She's also been diagnosed with Lyme's before, so you have chronic infection component. And whenever those things were resolved, there was work on trauma, working with other therapists outside of our space here, as well as the things we do from the biologic side, because we're an all-encompassing center. Plus, focusing on chronic infections, her memory improved drastically, but there's no way that we could have known that that was the direction she needed to go without doing some of the expanded assessments that we are now going to be offering to you more publicly, without being a part of our MaxWell Care program. So let us not forget traumatic brain injury patients. So patients will have, fun fact, the number one sign and symptom of having a prior concussion and head injury is not remembering the event. So there are many times that we ask patients in our initial intake, have you ever had a head injury? And they're like, no, I don't think so. We do an advanced QEEG, which we call an evoked brain map here. And turns out from the electrical patterns of that assessment, we can see that actually they did. And it might have been they fell when they were ice skating when they were 7. It could have been running, playing tag and slipping and fall. I mean, it could be not something that you would remember as a child, but that could have long-term effects that can affect your memory. Obviously, there's also the major traumatic brain injuries, car accidents and the like, that can really have an impact on that as well. So just figuring out, is it actually a prior head injury that's causing the memory challenges, is another avenue we can go down. So I've just given a couple examples of the ways in which the different lenses that we use whenever we're doing an expanded cognitive assessment here at MaxWell. That's really different and sets us apart from your standard neurologist team or within conventional medicine, mainly because We have access to a plethora of tools, and our clinicians are extremely versed in getting to suss out what could be root cause to your symptoms. So today we're focusing on cognitive decline, but as you can see, there's a lot of different versions of root causes that could be driving that symptom forward. And it's important to distinguish where to go from here. So we understand deeply how scary memory loss can be. A loss of your sense of self or the sense of self of a loved one is terrifying. And we take that very seriously. Part of why we are coming out with this new cognitive health assessment is to honor that path. The path of the patient experiencing the memory challenges, even if they're subtle, and the path of the caregiver and loved ones who are walking that path with them. I want to emphasize that if you are one of those individuals, you are incredibly brave for coming forward if you choose to move forward with this assessment and going down the exploring that path, because just speaking that out loud takes a lot of courage. And so I want to encourage that as well. At MaxWell Clinic, we've been helping people with their brain health for 20 years. We are going to have our 20th anniversary this year, which is really, really exciting. And brain health has been a keystone of our practice ever since it began. We've been doing a lot of work with neurofeedback and extensive EEG mapping. And so this is our sweet spot. We are a very brain-centric practice, which we are incredibly proud of. We use very special tests and proven methods to understand and improve your memory and thinking. With us, you're going to get way more, as I mentioned, in a cognitive health checkup than you'd be getting from conventional medicine practices, just because of access of testing and care, which we're really excited about. So let's talk about MaxWell Clinic's new unique cognitive health evaluation. We are so excited about this. So our assessments are not just standard evaluations. They're actually building blocks for your path to a more vibrant, proactive, and empowered cognitive future. We have solutions and recommendations for anything that we find as a next step, which is huge. And that sets us apart because we have the ability to provide the comprehensive evaluation and then dive deeper than most clinics can, because this information is going to be incredibly useful to you. And our clinicians personalize everything, so we really listen to you. You will find when you do our intake form for this or your loved one that we're going to ask a lot of extensive questions. It's going to take you a while to do. And we do that because our clinicians actually read everything that you write and put your history into the now and coalesce that with the new information we find. And that's a really big deal. So our cognitive health evaluation is a two-day experience where you will come to the clinic and you will have a half day of testing. So patients will arrive at 8 a.m. on their testing day. You will have fasting labs drawn, and we'll go into the details of everything here in a minute, but just an overview of your experience. So you'll have fasting labs drawn. You'll be greeted by our incredible hospitality staff. You'll have a brain health advocate that'll be walking with you throughout this process, you and or your loved one. After your fasting labs, you'll have a couple fasting procedures as well. Fasting meaning no coffee, just water that morning. So we'll go into what those are in just a second. And then following your fasting procedures, you will have a proprietary brain health breakfast with us, with a couple of our products that supercharge your brain's functions and its ability to have the neuronal pathways all talking to each other in really exciting ways. And then you'll do a standard cognitive assessment with one of our technicians, as well as an online test. Afterwards, you will be given a 7-day diet diary to take home with you. You'll be tracking what you eat over the 7 days. This is not in any way to create a scrutiny of what you may be bringing into your body and nourishing, but more of a data point of information to integrate in with the other information that we get to create a comprehensive plan and assessment for that root cause analysis of what may be causing your particular memory challenges. After you complete your 7-day diet diary, you'll wait another week. There'll be 2 weeks in between your testing day, and then you'll come in for a 90-minute visit, review of findings visit with Dr. Mark Lickey. Dr. Lickey is one of our esteemed MaxWell clinicians here. He has tons of experience in brain health and memory optimization. And you are in exceptional hands, because not only will he be going over the review of findings from each of our testing that we will be doing as part of your brain health evaluation, but he'll also be making informed decisions, hopefully giving you an idea of the most likely cause of your opportunity for improvement for your memory challenges that you may be experiencing, or your loved one. And then we be making recommendations for paths forward, which is really unique. So I'm going to back up a little bit. We're going to go into that half day of testing. So you will arrive to the clinic, have fasting labs. We do over 48 standard labs that are really unique to MaxWell that you won't have drawn elsewhere. You most likely have not had them done elsewhere. And then we do some specialty lab kits that are actually neurocognitive antibody tests, both IgG and IgM. IgG is your long-term memory antibodies. IgM is your alert. You currently have an immune response to the exposure to that particular antigen. We use a neurocognitive test through a specialty lab that can really show us, does this person have an immune activation against neurological antibodies? So that's significant. That is a significant test if that was the only test we did that would give answers to what could potentially be contributing to your memory symptoms. We also, within our standard, we call them standard lab set, it's very comprehensive. We will do your ApoE gene analysis status. ApoE gene has a role in Alzheimer's development, in the sense that if you get one ApoE allele from your mother, one from your father, so the ApoE is reported by two numbers. So it's either a 2-2 or a 2-3 or a 3-4. If you are a 4-4, that is the most significant risk for developing Alzheimer's dementia later in life. Now, I say risk because it doesn't mean that you have the diagnosis or that it will happen. In fact, there are a lot of things to do to mitigate that risk, and being informed is one of the most powerful tools that you can have in your toolbox to learn this information, which is really good. If you have a 3-4, just by having that 4 allele, then you've got a little bit more of a risk. And there's a lot we can do with that as well. So not only are we looking at your immune system activation, we are going to be looking at your basic body health. We're going to be looking at your thyroid function health. We will be looking at your hormones. We will be looking at a genetic analysis of your ApoE risk and status, all things that could be contributing to your neurocognitive decline, as well as the neurocognitive antibodies. So just in that alone, my goodness, do we have some clarity on where to go next? It's incredible. All of these results, after you are complete your testing and you complete your review of findings visit with Dr. Licky, of course, you'll have all these results posted to your patient portal, so you will be equipped with this information yourself as well. Following your lab draw, you're going to have a test done called the glycocheck. And the glycocheck is very special to MaxWell Clinic. We're one of very few clinics nationwide that have access to this particular test. It is a microvascular system assessment. Now, think about this. Your microvascular system, which you probably do not think about very often. However, your small blood vessels all feed your brain. So even though you may have some challenges in the small capillaries in other areas of your body, that will impact the amount that flows to your brain, and that dramatically impacts how efficient and effective your brain is. So the glycocheck actually gives us a read on how well your body is perfusing and how well your microvascular system is working. It's really fun because you're going to take a camera and it's going to go underneath your tongue and you're going to watch on a screen, and you're actually going to be able to see your own blood vessels rolling through and how fast they're going. It's one of the most fun tests to watch. So you will put that underneath, it will be analyzed, and then as part of your review of findings, Dr. Licky will be able to tell you how well your microvascular system is working. It's amazing. So this is a layer on the information that we're going to get, because that goes into, if your microvascular system is really tanked, then improving that, but all your other test scores look great, for example, then okay, now we know that your brain is not getting enough blood flow and we need to work on your vascular system support. Fantastic. The next thing that you're going to have done is called a cellular health and body composition assessment. So body composition has a lot to do with brain health. You have something called a phase angle where your cells will communicate with each other based on hydration status, body fat mass, obesity levels, as well as skeletal muscle and visceral fat. And believe it or not, high visceral fat can decrease your your brain's ability to function at its highest level. So this piece of information, as far as your body habitus goes, makes a really big difference in lifestyle recommendations to optimize moving forward. You put that with a genetic risk to potentially develop Alzheimer's, and you've got yourself a really personalized plan on how to move forward. Next, you're going to have a heart rate variability test done. Heart rate variability can tell us if your limbic system in your brain is stuck in fight or flight or not. Sympathetic or parasympathetic, rest and digest, or fight, flight, or freeze. And this has a lot to do with how effective our brains work. So if you are in a stress state, we are animals. Never forget we are animals. And so if you are worried about survival and huddled in a corner and thinking when the next threat's going to be there, it's really, really hard to think creatively, or where was I supposed to go again? Or what am I in this room for? And this is a easy, quick test for us to know, wow, stress is really at the centerfold of what you're experiencing. Pair that with some hormone assessments, and we really have a good picture on where we need to go from here. We have something that I'm really excited about because so you will have something called a MoCA test done. A MoCA test is a Montreal Cognitive Assessment, and it is standard of care. It is a standard of care test that you'll get at any neurologist's office to see, how do I stack up? Do I have cognitive challenges? Great. So we want to make sure at MaxWell, we like to make sure we do the standard of care plus, 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 plus. So you will have that done as part of this assessment. But what you're also going to have done is something called a CNS vital signs. This is vital signs for your brain, and it is mapping out your brain's performance. It is tracking your cognitive progress, but it can actually tell you, are you having challenges in verbal memory? Are you having challenges in visual memory? Are you having challenges with face recognition? Are you having challenges with mood regulation? What is your overall neurocognitive index score? So by breaking it down into these components, we could actually get a little bit more guidance and clarity on where exactly these memory challenges are living. So it's taking the information from the standard test and expanding it with much greater detail so that you can have clarity and answers from this assessment, which is huge. So as part of your brain health assessment, so the cognitive health evaluation, you will be submitting a lot of information on your medical forms, as I mentioned, as part of the new intake. But when you're here and spending time with Dr. Licky as he's going through your review of findings, one of the most important review of findings is you. Getting to know you, your story, doing a brief neurological assessment, just assessing how you communicate, look, function. Is there a lag in the thinking process? What's your story? What are your significant goals? Our brain health advocate will be asking you that question. Why are you here? What's your desire? What's your main goal? What would you like to achieve by working together? And you are at the centerfold of everything that we do. And so your visit with Dr. Licky is really, really important to this process. Yes, we collect a lot of data and we make sure that you are exceptionally cared for while you're here getting these expanded assessments, or your loved one or family member. And we also really highlight that time that you spend together with the clinician as he's going through the things we've seen, getting to know you and coalescing that all together for opportunities for improvement to optimize. It's a very, very special thing. And I hope that you guys get a lot out of it because we're incredibly excited. So potential paths forward. Okay, so I have my testing day. I come back. You tell me what you think is going on. What are my paths forward? Well, there's a numerous amount of things that Dr. Licky could recommend for you. One of which, as I mentioned earlier, is therapeutic plasma exchange. Therapeutic plasma exchange is a phenomenal therapy when it comes to helping optimize both longevity and brain health. If there's any risk or sign that early neurocognitive decline dementia or Alzheimer's is happening, that is a path forward that is really supportive. It's most effective when paired with our MaxWell Care program to be able to have a long-term clinician to walk alongside you to also add in tailored supplements, diet, lifestyle, any medications that might be needed, put some neurofeedback in with that. If you need to do an EEG assessment, we can take care of that as well. We have some optimization IVs as part of our IV services. We do have a hyperbaric oxygen chamber here as well that might be paired. All of this, of course, overseen by one of our MaxWell Care clinicians. There are a lot of options and there is a lot of hope. So in summary, the most important thing about our cognitive health evaluation and assessment offering is we want you to test and not guess about your cognitive health. So remember, our brains, like every part of our body, need regular checkups to ensure they're functioning at their best. Take this step towards a brighter, healthier cognitive future. We understand how scary memory loss can be, and we're here to help. If you'd like to move forward or learn more, text the word BRAIN to 615-370-0091 and we'll send you more information. You can also visit maxwellclinic.com/brainhealth. So I'm going to say that again. Text the word BRAIN to 615-370-0091 or visit maxwellclinic.com/brainhealth. Something that you probably are all waiting on the edge of your seat about that I have not mentioned yet is the cost. So the cost of our half day of testing and 90-minute review of findings visit for our entire comprehensive cognitive health evaluation is $2,900. This is significant. This price is remarkable. We have worked really hard to get this all grouped together in the most affordable price point possible. So the retail value of something like this would be well over $4,000. And so to be able to offer it to you for $2,900, and to make it available broadly to the public outside of people who are already patients with us is something that we are so excited about. We get so many phone calls about people's brains. And my memory is slipping. What do I do now? Well, I don't think I need plasma exchange. I don't think I need to become a full patient. I just want you to tell me what's going on with my brain. I just want to know why my memory is slipping. I just help me have answers. Here is the answer. This evaluation can be your solution to that problem that you may be feeling. So I'm going to move on to some questions. The first one is, does this help with ADHD? Absolutely. So when we are now, I will say, if you know for sure that the central point of your memory challenges is ADHD, then I would absolutely recommend also considering a QEEG brain map and our we have a neurofeedback only program. So it most likely will be recommended for you to move forward and go down that path as well. I would do both in concert. This cognitive evaluation program is really tailored towards figuring out why, like what the root cause is for memory. So if you know for sure it's ADHD, then I would recommend considering our MaxWell Care program and our neurofeedback only program, or both in concert. But this is an amazing initial assessment to be able to solidify, yes, I think that's what's going on, and here's where you should go from here. Next question, what makes the MaxWell Clinic's cognitive health evaluation different from other brain health assessments available? I have a neurologist. Will he likely run all these tests as well? He will not. He or she could be a lady neurologist. So MaxWell Clinic's cognitive health evaluation is exceedingly different in the fact that, one, the LabCorp is the lab that we partner with here in office for our what we call standard labs. We pair in and put in labs within that test panel that is more than considered standard of care. So we're going to be looking at different organs and aspects of your body because we believe each body is a tensegrity and it's all connected. Then your neurologist will be looking at. Most likely your neurologist would not be looking for various other organ sets. They're going to focus on their organ of specialty, which is the brain. They will do the MoCA assessment, as I mentioned, and then that will most likely be it in order to assess your memory, versus at MaxWell, we'll be doing antibody testing, we'll be doing CNS vital signs, expanded cognitive pulse test as well, pulse of your brain, by doing that expanded memory test. We'll also be looking at your microvascular system, your fight or flight system, and your body composition as well, amongst a few, as well as the genetic testing with ApoE. So all of that would not be offered standard of care in neurologist's office. Will this evaluation test for the Alzheimer's gene? Yes. It will test for the ApoE status. So that is a really big deal to know whether you have the propensity or likelihood to potentially develop that. I've been experiencing minor memory lapses recently. At what point should I consider undergoing a comprehensive cognitive evaluation like this? Now, the sooner the better, people. So when you start to notice your own memory lapses, it is already to the point where it is worth investing in the most precious organ that you have, one of the most precious organs that you have, to further evaluate what might be the reason that you're experiencing those things. So yes, yes, yes. Ladies, I'm talking to you as well. Though if you're feeling young and you're going, I just can't remember the things like I used to, come in, let us take good care of you, and let's figure out what might be going on and where we can go from here, because we can help you as well. So it's not just those, older, wiser beings out there. This can affect is good for anybody at any age. I have a family history of Alzheimer's. Can this evaluation help determine my risk and offer preventative measures? Yes. So this cognitive health evaluation will help you get a really good idea of what are my current risk factors. Do I have the genetic propensity to develop Alzheimer's long-term, and what do I do about it, and where do I go from here? My current doctor has already diagnosed me with a cognitive disorder. Can your MaxWell brain health evaluation offer insights? Absolutely. Absolutely. So as part of your medical intake, you'll put down all of your past medical diagnoses and the work you've done so far. Dr. Licky will review that and put that into his, compendium of information that they're collecting on you, and add that, see through the lens of the diagnosis that you've already been given and interpret the data as such, and then make personalized recommendations for you. One of the most unique things about MaxWell Clinic is that no two patients are the same. We do not have a rote program of recommendations for any one individual. We individualize everything, and we take your personal desires, goals, history, and current symptoms into account for our recommendations. Will I get a diagnosis? Maybe. It depends, because it depends on what we find. If Dr. Licky feels confident in the information that we've given that a diagnosis is warranted, then that information will come through in the review of findings and how that's presented. However, if there's still, you are an onion, you have many layers. If there are still more layers to get to the root to know what is at the bulb, I don't think that's the root of an onion. We'll go with it. What's at the center fold? Then he'll recommend the next steps. No matter what, you will leave your visit with, here are my next step recommendations for why I am having this evaluation done. How much time at your clinic is involved in this? As I mentioned, you're going to have a half day of testing. That'll be from 8 to noon. And then 2 weeks later, we are not open on weekends, so it may be a little longer than 2 weeks. It's 2 business weeks, 2 business days full of, later. You will have a visit with Dr. Licky, which is a 90-minute follow-up visit. You will have a brain health advocate who will be in contact with you before you arrive to give you all of your test prep instructions, and who will be checking in with you during those 2 weeks in between. But that would be the overall time span. So how do I sign up? Visit Maxwell Clinic/brain health or text brain to 615-370-0091. Last question for somebody who's already has their first appointment at MaxWell. Yay, we cannot wait to welcome you. And is there a price discount if you're already under a program? There is not. This evaluation and assessment is separate from our other programs because it is brain focused and it is all very condensed. So it's a great launch pad into one of our longer programs because it'll get you so much baseline foundational testing. However, it would not be a discounted program at this time. If you have any other questions, feel free to reach out to us after. Thank you for your time this evening. I look forward to seeing you all and your loved ones around Maxwell Clinic, hopefully, for a cognitive health assessment and evaluation with us. Have a good night.